Testolone RAD140. Building body mass without the side effects of steroids? It could be possible thanks to Testolone. This synthetic drug is a research compound studied for the treatment of various disorders in women, but it also gained popularity among bodybuilders and athletes. But what is this drug, and what are its benefits? Find it out on our Testolone review. What is Testolone? Testolone RAD140 is a selective androgen receptor modulator, or SARM, developed for the treatment of breast cancer and muscle wasting disorders in women. Since its development, scientists have also evidenced positive effects on delaying the onset of neurodegenerative disorders in men. It's easy to understand bodybuilders and athletes take advantage of its anti-muscle wasting properties. The drug was developed in 2010, and it's rather new on the market. According to initial studies and company reports, Testolone has promising bodybuilding properties. Up to this point, you might be wondering why to replace the good old steroids with a SARM? Well, the difference between steroids and SARM is the capability of the latter to act in a targeted way thanks to its selective mechanism of action. The selective androgen receptor modulators have a special affinity for tissues like bone and muscle, but they do not affect other tissues including liver, brain, and prostate. SARMs are also metabolized differently. The human body doesn't convert them into estrogen or DHTs, which means you'll never have to worry about unwanted effects like water retention, hair loss, and gynecomastia. Due to all these benefits, Testolone is one of the most praised bodybuilding supplements today's market can offer. How does RAD140 work? RAD140 is a unique supplement that has the ability to select the tissue where it binds to activate androgen receptors. One of its purposes is to build body mass and prevent muscular waste, but according to some studies, it can also have a positive effect in combating the age-related decline of testosterone in men. Testolone also has a high bioavailability and anabolic effect, helping in reducing body fat and building muscle mass without the side effects of anabolic steroids. Due to these properties, RAD140 became popular among athletes and bodybuilders. The product can successfully replace pro-hormones and steroids, reinforcing the effects of testosterone therapy. What to consider before using RAD140? Although developed for women, RAD140 comes with important benefits for users of all genders. However, there are a few things you should consider before deciding whether or not this is the right product for you. Testolone is a rather new product. Its first clinical trial phase started in 2010, but there is still little evidence on its long-term side effects. Up to this date, research has revealed negligible side effects, which makes scientists believe it can be used in all safety. Thorough research is anyway desirable. Because the product is still in clinical trial, getting your hands on the real deal is also tricky. Many bodybuilding supplement sellers may propose fake RAD140 that may not bring the desired benefits. However, if you're selecting your supplier carefully and don't mind using a new product, then Testolone can undoubtedly improve your bodybuilding game. How to use Testolone? Testolone can be used by all bodybuilders, either as a standalone dose for a cycle of 6 to 8 weeks or as a supplement to your test cycle either during the cruising or blasting phase. Those using SARMs may only benefit from a standalone dose. However, adding Testolone to a test cycle comes with other advantages, as it amplifies the effects of the test while reducing the side effects of other supplements, especially on liver and prostate. The recommended dose is of 10 to 30 milligrams a day. Women and first-timers should start with the lower dose and work their way up. Advanced bodybuilders and athletes may start with a dose of 20 milligrams a day, either as a single dose or split up between morning and afternoon. RAD140 benefits and results to expect. Testolone comes with a wealth of benefits. To start with, RAD140 does not have the side effects of popular steroids, because the body doesn't convert it into estrogen. It won't cause hypogonadism or gynecomastia in men, nor clit enlargement in women. RAD140 can also target the tissue, and it only binds on muscle and bones. It will completely avoid your liver, prostate, and brain. This means little to no side effects, including water retention and hair loss. RAD140 is great for bodybuilders and athletes who care about performance but are concerned about the potential negative side effects of traditional performance-enhancing supplements. Men sensitive to gynecomastia, or those with decreased testosterone levels due to the use of anabolic steroids, may also benefit from RAD140. Lastly, RAD140 also makes a great supplement between steroid cycles, helping maintain the results. Developed to build muscle mass, Testolone will make your muscles look fuller day after day. It also increases lean gain, boosts your strength, and has positive effects on your mental well-being as well. You can expect to see the first results after 1 week. Testolone side effects. Up to this date, Testolone has no known negative side effects. However, the drug is still in its first clinical trial phase, and we will update our article as soon as new research is released. Final verdict. Whether you're a bodybuilder or an athlete, if you want to prevent muscle waste, gain lean mass, and improve your overall well-being, Testolone RAD140 can be the right supplement for you. It has no side effects up to this date, bringing the benefits of steroids without their downsides. While criticism regards the lack of extensive trials and research, there are many clinical studies that prove this drug's efficiency. Bodybuilders and athletes also praise its benefits and the lack of side effects. As shown in this Testolone RAD140 review, the drug is completely safe to use at the recommended dosage, and although it may be hard to source, taking RAD140 is totally worth it.